Ma'am, Yogesh from IT department. We are live on YouTube now. We can start.
Okay. Okay. Thank you, sir. Yes. So, good afternoon, everyone. On behalf of Symbiosis Center for Emotional Wellbeing, I, Harshada Khadkar, warmly welcome you to this webinar on ADHD, that is Attention Deficit Hyperactivity Disorder. I work as a psychological counselor at Symbiosis Primary and Secondary School, Prabhat Road, Pune. October is special as we celebrate World Mental Health Day on 10th of October, and it is also ADHD Awareness Month. Today, our goal is to raise awareness about ADHD. Thank you all for being here. We are highly privileged to have Dr. Girija Mahale ma'am with us, who is the head of Symbiosis Center for Emotional Wellbeing and a highly experienced consultant psychiatrist. Dr. Girija ma'am has worked extensively in the field of mental health as she has passionately decided her career in working towards mental health of children, adolescents, and young adults. She also heads the BSc Mental Health degree program for those aspiring to pursue a career in the vital field of mental health. Today, she will be sharing her valuable insights on this important topic. So, ma'am, welcome, Dr. Girija ma'am. It is a pleasure to have you with us today to talk about such an important topic.
Thank you so much, Harshada, for the lovely introduction, and a warm welcome to all our audience who have joined us on this Tuesday afternoon. I welcome you to this informative educational session on ADHD. Thank you, Harshada.
Thank you, ma'am. So before we begin, if you have any questions, please type them in the chat box of YouTube. We will address your questions, queries, and doubts towards the end of our webinar. So, ma'am, my first question is, when a child is not listening, becomes hyperactive, or gets into frequent fights, many parents and teachers attribute these behaviors to ADHD. So, can you briefly explain what ADHD is and why it is important to raise awareness about it?
Correct. So yes, today, we're talking about ADHD, and it has nowadays become a very common thing to hear parents, teachers saying, this is ADHD. Is this ADHD? So first of all, let me define what ADHD is. ADHD refers to Attention Deficit Hyperactivity Disorder. So it is a neurodevelopmental disorder. Means what? That children are born with some differences in the way their brain is wired, right? In every person's brain, there are neurons. Neurons are the cells that communicate with each other through chemicals in the brain, which are called as the chemical messengers. Okay, so this messenger system is somewhat affected in children with ADHD. There are differences in the way the neurons communicate with each other, leading to deficits in three areas. Area of attention, in being able to have focus or attention span. The second symptom would be increased activity, or also called as hyperactivity. And third is impulsivity, where they are, instead of having a response time, they react immediately, and that's called as impulsivity. So there are problems in these three areas: attention span, there is increased energy levels, therefore leading to hyperactivity or increased motor activity, and thirdly, impulsivity. Now, these three symptoms can vary in terms of their intensity from individual to individual. So not every child with ADHD will present with the same amount of impulsivity, hyperactivity, and inattention. Some children, especially girls, you will find that inattention is more common as opposed to hyperactivity. Whereas in boys, you might find that the motor activity or the fidgetiness, the restlessness that is often associated with hyperactivity is more common than attention deficit. And impulsivity can often be seen in both genders, both girls and boys. And this manifests itself, these three symptoms manifest itself in behaviors, such as in classrooms, you might observe that these children are unable to sit in one place. They're unable to follow instructions that the teacher has given them because of the low attention span. They're not able to complete their notebooks or whatever is written on the board because they get distracted very easily. They're not able to complete their notebooks. These children might often be found to be disrupting the class because they get distracted so easily, and because they're unable to sit in one place, that fidgetiness leads them to sort of, disturb the other kids in the class. And therefore, the likelihood of these children being labeled as disobedient, naughty, or even lazy, not completing their work, is often seen with teachers and parents. Even and not just in school, you will find that these behaviors are there in any setting. So be it home, be it the playground. The mother will often say that this child is very difficult to manage. He's very energetic, but he doesn't play with one toy. He will get bored very easily. He has very high level of energy. He doesn't sleep early. He will, even if I'm making him study, he will just sit for 5 minutes, then get up, do something else. But that task also he will not complete. Even while eating food, the mother will find it very difficult for the child to be sitting in one place and eating food. The child will get up very often and will not complete the meal in one go. So these are the common complaints. Even when they're taken to sports ground, the child will find it hard to play one game or follow rules of the game, and therefore can get into trouble and mischief with other kids. And therefore all this will lead to further interpersonal problems in relationships, etc. So that's how ADHD commonly presents. And once you will ask me further questions about diagnosis, I'm
Yes,
sure.
yes, okay, yes, thank you, ma'am, for that insightful explanation. Yes, ADHD is a complex condition, and definitely understanding about ADHD will lead to more acceptance. So moving ahead to our next question. In India, many people believe that ADHD is simply a phase that will resolve with maturity, leading to delay in diagnosis for many children. So what procedures should be followed to properly diagnose ADHD, and how can we encourage earlier evaluations? And what steps should parents take if they suspect their child has it?
Yes. So as I said, it is a neurodevelopmental disorder, which means that it is there since birth, but we do not diagnose it till the child has reached primary school level, which is around 5 to 6 years. Because before that, generally you will find, Harshada, that children are very overactive. They have high levels of energy. And unless there is a structured environment, these children will explore their environment because that's the nature of their developmental stage, to explore. That is, they will move about, they will play with different toys, explore those toys. And therefore it's often difficult to differentiate ADHD from normal hyperactivity seen in very young children. But once they are in a structured environment like a preschool or a primary school setup, where there are rules and regulations of a school, you will you will be able to identify these kids very distinctly. Because despite the rules being there, these children will find it very difficult to follow the rules. The children will not be able to follow the multiple instructions that teacher gives. So for example, if she said that this is the timetable for tomorrow, you need to get this books, you need to get your craft paper, you need to get your drawing book. Invariably, the child will not be able to follow the multiple instructions and will forget to get majority of the things. Moreover, in the classroom setup, as I explained to you before, the child will demonstrate that in a period, say, of 30 minutes or 40 minutes, whatever is the duration of a single class of a subject, the child, after a couple of minutes, will start fidgeting with their pencil, pen, notebook. Often they will you will find that their book will fall, or their pencil will break. Then half the time they'll be sharpening the pencil. They will not know what subject is going on. They will miss the instructions given by the teacher. They will lag behind in their work. And those will be the early symptoms to catch. Similarly, the mother, being the primary caregiver in most cases, would have observed that this child, right from childhood, is very, very active, energetic, but the mother will also notice that this child finds it hard to pay attention. And the child, often will even not pay attention to danger. For example, while crossing road, the child might leave the hand of the parent and run. Or even when the child is in the kitchen, the child will, even if the mother has said, there is danger here, like if it's near a gas stove, the child will not bother and might quickly touch the gas pan. So things like that, which are very risky, also the child might be engaging in. So if the parent notices or the teacher notices this kind of symptoms or behavioral signs in children in classroom or at home, then this should not be neglected. Okay, they should not be bypassed, or it should not be said that no, maybe it'll settle down. Maybe the child is really high in energy. We should always refer this child to a school counselor. That would be the first step. Refer the child to a school counselor. It's okay. The child, if everything is okay and the school counselor feels that this is just part of normal development, great. No need to worry. But if there is an issue with attention span, or the child is found to be hyperactive, then we can take the school counselor would be in a better position to guide the teacher as to what interventions she can implement in the classroom, or she can even guide the parent. She can take a proper developmental history from the parent to understand and assess whether this is ADHD. And she can even suggest certain behavioral interventions to the parent. If, of course, the symptoms are quite severe, there are certain scales that the school counselor might use, which the scales might be, the teacher may have to fill out a questionnaire, or a parent may have to fill out a questionnaire, which will give the school counselor an idea whether this is just normal high energy level, and or whether this is proper diagnosable condition of ADHD. Once that screening is done, the school counselor will, if the scoring is high and falls into that domain of ADHD, then the school counselor might refer this child for further intervention, either to a developmental pediatrician, or to a child and adolescent psychiatrist, or even to a child psychologist for further assessment and intervention. So first step, school counselor. If it's a parent who has identified it in at home and the teacher is not identified, the parent should first inquire with the teacher that how is the behavior of this child in school. Even during parent-teacher meeting, parent should definitely, if the parent is suspecting that, ghar mein bilkul nahi baithta hai bachcha, is not studying, and the mother is worried, or the parent is worried, then the parent should definitely talk to the teacher and find out whether such symptoms are present in school as well. Because for ADHD, remember, having these 3 symptoms present in all sorts of settings is important for diagnosis. If the child is just showing poor attention span and is hyperactive just at home, but in school is following all the rules and regulations, is paying attention, notebooks are complete, everything is following properly, then this is definitely not ADHD. So children with ADHD will find difficulty in attention span wherever they go, irrespective of whether there are rules or boundaries or not. Okay, so that's one way of distinguishing whether this is just purely behavioral or whether this is a ADHD or a neurodevelopmental disorder. So once the child goes to a child pediatrician or a child and adolescent psychiatrist, they will do proper assessment. There are certain tools that the psychological tests that the psychologist does, which will also determine whether there are problems in other areas like fine motor skills or intelligence or learning difficulties, because of which also sometimes the children may display hyperactivity. Okay, so the battery of tests may have to be carried out to determine which are the areas of difficulty that the child is displaying. And based on that, the child will, the doctor will tell what sort of a condition does the child have. And based on that, the interventions will be followed. So therefore, the point I want to highlight here is that both teachers and parents therefore need to be aware, need to be vigilant, and need to bring this to the notice of the school counselor early on, so that we do not miss that window period. And I'll tell you why. Once you ask me about interventions, I will explain the importance of identifying this early. The earlier you identify and earlier you intervene, the results are much better. And I can give you n number of examples in schools where, you, Arshada, you yourself are aware, you work in a school setup and you've
Yes,
seen
ma'am.
how early intervention can beautifully help the child. And not just the child, it helps the teacher, it helps other peers in school, class, and it helps the parent as well. So it's a
Yes.
win-win situation for all, and the future of the child is saved.
Thank you, ma'am. So yes, encouraging earlier evaluation is vital, and it starts with open conversation, as you mentioned, among parents, educator, and professionals like us. The sooner we identify and address these challenges, I feel the better we can help the children in reaching their full potential. So, ma'am, my next question is, ADHD is often perceived as a childhood condition, but can it be also diagnosed in adulthood? What are some signs that adults should be aware of?
Sure. So as I said, it's being a neurodevelopmental disorder and there being a different way in which your brain is wired. It will continue into adulthood rather. In 90% of the cases, it will continue into adulthood. However, the symptom intensity may differ. And because now once you grow up, you're out of the educational setup, the difficulties might where these individuals might encounter difficulties in their personal life, in their professional life, in their careers, right? So adult ADHD can present as, because they will have difficulty in organizing things. In fact, it impairs their executive function. So there is a part of the brain, which is the prefrontal cortex, which is called the executive brain, which helps in organizing, in time management, in decision making, problem solving, impulse control, emotional regulation. So in ADHD, there is often a delay in the maturity of this executive brain. Okay, and therefore there might be impairments in these executive functions, and you'll find that individuals find it hard to organize their time. Therefore, time management becomes a problem, and they might often be delayed into going into work, or they might miss important appointments. They may find it very difficult to plan their activities. And this will all therefore result in interpersonal problems also, because individuals around them or colleagues around them will not be able to understand why is this individual not able to organize or manage his time better. It will have its repercussions or consequences at workplaces. Similarly, in personal life, these individuals, because their organizational skills are poor, they might have, they might keep their things in a chaotic manner. They may not organize their things properly. Their clothes might be lying all over. They may forget important activities, events, important dates. And because of the impulsivity as well, that can result into emotional outbursts as well. And that can lead them to have interpersonal problems, especially with their spouse or with close relatives. And so these sort of symptoms are likely to be more seen in adults as opposed to in young children.
Okay, okay. Thank you for clarifying that ADHD is not just a childhood condition, it continues. So it is also crucial for adults to, aware, and so that many adults, they just don't recognize the signs, as many may be unaware that they have it. So thank you, ma'am, for this
Just one
clarification.
addition that
Yes, ma'am.
I want to make here is that nowadays we do get a lot of, because I work in a university setup with higher education students. Many students do come up, who are 18, 19 years old, and they say, ma'am, I think I have ADHD. So ADHD does not, however, begin in adolescence or young adulthood. For diagnosis of ADHD, the symptoms have to be there right from childhood. So it's not, so if you're having difficulty in attention or concentration, not in childhood, but suddenly now you're come to higher education and you're finding it hard to concentrate, or you're finding it difficult to focus, then it's probably not, it's not ADHD. It could be because of anxiety, depression, or any other condition. But ADHD, for diagnosis of ADHD in adults, the condition has to be present right from childhood. And therefore, a good developmental history is very, very crucial for a physician or a psychiatrist to decide whether this is adult ADHD or not. And there are lots of screening tools that can also assist the doctor or the psychologist in making a definitive diagnosis of adult ADHD. Yeah.
Thank you, ma'am. So, in an ADHD treatment plan, multiple interventions are often involved, including psychologists, occupational therapists, and psychiatrists, which can feel overwhelming for parents most of the time. People also believe that ADHD treatment is solely about medication and it leads to dependency. Can you clarify the role of medication in managing ADHD and address the concerns around dependency and the side effects of medicines?
Sure. Right. So, in treatment of ADHD, we use multiple interventions. As you rightly said, we may need the assistance of a occupational therapist, a child psychologist, a remedial educator, or even a child and adolescent psychiatrist. So the role of each multidisciplinary team member is different. The child psychologist will do the assessment and will also suggest the behavioral interventions for ADHD. But if the condition is quite severe, in the sense that if the hyperactivity is so high and the impulsivity is so high, or the attention span is so poor that the child is just not able to sit in class, or the behavioral issues arising out of these three symptoms are so concerning. For example, if the child is getting very disruptive in class, and because of which he's getting into trouble, he's getting into fights with other kids, then this is a symptom which needs an immediate intervention. Right here, we cannot wait for the behavioral interventions to start, and then it will take some time for the child to show improvement with behavioral interventions. But and this becomes a concern for school, because the school, if the child is hitting somebody else, the parents of the other child are also not going to keep quiet, nor are the teachers. So that's where medicines play a very crucial role. And fortunately, Harshada, we do have some excellent medicines to treat ADHD. Treat ADHD, not cure. So ADHD is not a curable condition, because as I said, it's in the brain wiring. There is a difference, and that cannot be completely corrected with medicines. But medicines, they are of two categories. They're called as the stimulants and non-stimulants. Basically, they're acting on certain chemicals in your brain, increasing the levels of certain chemicals in your brain that help with attention span, that help with decreasing the restlessness or hyperactivity, and with impulse control. So that's the basic goal or aim or mechanism by which medicines work. Now, within stimulants, there are again two main categories of stimulants that most doctors would use. One are called as it's called as a methylphenidate, and second is amphetamines. Both increase dopamine in your brain, which is involved in attention span, motivation, concentration, working memory, etc. So these medicines are available as Ritalin or Concerta, Adderall. These are the trade names of these medicines in the market. Okay. So again, within them also, they're either short acting, or there is also a long acting extended release medicine that is available in the stimulant category. Short acting, the effect lasts for only a couple of hours. So essentially, they're given during school time, so that especially if the child is, say, going just to primary school and the school is, say, for 6 hours, then that short acting medicine will enable the child to be able to focus in school and will be able to concentrate in school, and it will not hamper the child's academic performance. Okay. But the advantage of extended or long release is that you just take it once a day in the morning after breakfast, and after that the effect lasts for about 8 to 12 hours. So you'll have sustained attention span, and the side effects are also low, and you don't have to repeat the medicine. So advantages of extended release are more than the short release one. Now these medicine, these are available only by the prescription of a psychiatrist or a developmental pediatrician, because there is certain risks associated with using, if you use the medication not indicated. Okay, it has certain dependence potential, because they're stimulants. They need to be given in a certain dosage and over a certain period of time. You just cannot keep continuing the medicine, or so, as there is a risk of dependence associated with it. But the doctor will be the best person to guide the parent with respect to the same. Now, with every medication, there are side effects. Like anything, even if you take a crocin tablet, there will be some side effect, right? So similarly with ADHD medicines also, there are side effects, but you can definitely minimize these side effects through proper instruction. For example, the common side effects with the stimulant medication is loss of appetite, and therefore leading to weight loss and stunted growth. This is the most common and concerning side effect for parents. What can be done for that is giving the child medicine after food, so that the child has already eaten the food. Secondly, giving the child food at short intervals, so that if the child is not able to eat a heavy meal at one go, you can split that meal in over a period of time, and the child eats at regular intervals. Also, you can what you can avoid giving the child is sugary foods. Instead, give foods with complex carbohydrates and rich in protein, so that the growth is not retarded and the child feels full, and the growth is and the child nutrition is not affected at all. Okay, so such things easily can be done, and we have seen that children tolerate the medicine very well. And most importantly, it definitely, in 99.9% of the cases that I have seen, it enhances their attention span. It helps them with the education, and that's the most empowering thing for the child, because I'm unable to complete my notebooks, or just scolding me, how it's impacting my self-esteem. It's definitely going to make me feel low. It's going to affect my academic performance. I'm going to feel a little embarrassed about my marks, and to other children teasing me, bullying me. And then I start taking this medication. Now this made me to so it's like, if I can't see properly the board, I use glasses, right? And the glasses help me to see or read the board clearly. So medicines play the exact same role. They are an assistance to you, help you to focus, help you better, and the child will the child's only problem is not being able to focus, and the medication will be able to correct it, and the child will be able to perform to its potential. There is another category which is more safer than the stimulants, which is the non-stimulant. But it takes a couple of weeks for this medicine to act. Immediate acting, like the stimulant medication. There are various, again, types of medicines that are used in this non-stimulant category, called atomoxetine or clonidine, bupropion. These are some of the names of medicines that are used for ADHD. They're also very beneficial, but as I said, they're not immediate acting. So for children with severe ADHD, generally the doctors would prescribe the stimulant medication. And children who have moderate or mild ADHD, then they might use the non-stimulant type of medication. Okay, and once they grow into, to avoid the side effects, sometimes the doctors will also give drug holidays, like when the student has vacations or when it's a Sunday or a weekend, then the doctor will tell the parent that don't give the medication on these. It's okay for the child to be a little hyperactive on those 2 days. Okay, and so that the growth retardation side effect we don't have, plus the abuse potential is reduced. Even in summer holidays, during Diwali break, Christmas holidays, we can give drug holiday
Right.
and then resume the medication once the condition. Yeah. I hope I have done justice to your question.
Yes, ma'am. You clarified the role of medication in managing ADHD. It is important for parents to understand that while medication can be a valuable part of treatment, it is just going to be one piece of a comprehensive approach, I feel that. So, yes, ma'am. So, my next question to you is, many parents seek ADHD assessments and treatments for their children, but it is equally important for parents to implement effective strategies at home also. What are some practical strategies that parents can use to manage their child's ADHD at home?
Yes, very, very important. I think this is most important question because I think this helps both parents, teachers, and the child immensely. And this is something very at home and even in school. So for parents, once we understand the science behind ADHD, where exactly is the problem, behavioral interventions become easy to understand and implement. So since as I said, the child has difficulty in attention span, right? So giving multiple instructions to this child is not going to help. So try and give one instruction, not very convoluted, very simple instruction. And how would you give that instruction? By looking into the eyes of the child. Eye contact is important so that the child is paying attention to you while you're talking, and therefore if you're making only the books that the child is meant to study, it's important and important. So one book at a time and minimal instructions. You can use visual. Sorry, I think I lost my internet
Yes,
connection.
so
Apologies. Am
no problem.
I audible now?
Yes, ma'am, you're
Hello?
audible. Visible also, ma'am.
Sorry, I
No
lost
problem,
my
ma'am.
internet. Yeah,
No problem, ma'am.
correct. Great. So, yeah. Yeah. So I was saying that at home, the parent can, give minimal instructions. One instruction, a child needs to have just one book on the study table, one pencil, one rubber I might need for studying. Use of positive reinforcement was use of praise. If the child has done the task, then praise the child for doing the great work. It really motivates the child to further. Punishments and labeling, judgment not to be done. child not to be sent, or you're different, you have ADHD, not to use any of these labels for the child is high energy. This energy can be utilized by enrolling the child in some sports activities, some high intensity sports, whether it's long tennis, football, whatever the child enjoys playing. Definitely involve the child in sports activities. It not only helps to channelize the hyperactivity, but the child also learns collaboration, teamwork. It helps build their social skills, their interpersonal skills, and to manage the impulsivity also it really helps. So swimming, sports are all great activities for children with ADHD. Also, parents themselves should be practicing active listening, because, as I said, these children are impulsive. They are very reactionary, and for them to be able to practice of being responsive rather than reactionary, and taking that pause after everything that they have listened, important for parents to demonstrate the same. Also, what I've often seen in parents with children with ADHD is that they often give them gadgets, because often, especially if both parents are working, difficult for them to manage this child who is very hyperactive at home. So I've seen many parents will give them mobile phone in hand. I see it in restaurants also, that they will give them a mobile phone in hand so that they are engaged in playing games on that, and the parents can enjoy their meals, or they can, at least for some time, there is quiet and peace in the house. But I'll tell you, this is extremely detrimental, because actually these games on mobile phones are actually very stimulating. And in fact, even in normal children, we are seeing this, that attention span of children who spend excessive time on gadgets is decreasing. And we saw that during the pandemic, when children devices or gadgets, we have seen that their cognition got impacted, their attention span, their working memory, their concentration, all got impacted. So devices is not the answer. As I said, involve them in outdoor play as much as possible. Have a structure or a routine to their day. Have a fixed timetable that, they need to do this, they need to, and again, put it on a paper, put it in nice sketch pens, involve them in making that structure or timetable, put it up on their board or whichever place they like, nicely colored. Do it collaboratively with the child, so that the child is involved in that process, and therefore takes interest. Make a reward chart for the child, so that every instruction that the child follows, you can create a reward list. What are some of the things that the child would like to have, and depending on what the performance of the child needs to be rewarded, and that's really motivating for the child. Also, meal times, as far as possible, all family to sit together. No use of TV during meal time. One thing at a time, no multitasking. That's also very, very important. Sleep is extremely crucial for children with ADHD. So having a good sleep routine is also very important. So again, practical tips for that could be having a fixed early time for bed, have early school, say at 2:33, allow the child to have some free play for about an hour. Then, have a timetable where the child is supposed to study. That study time also should not be too long, because these children will not be able to sustain. And invariably, you will feel frustrated that the child is not studying. So rather, give them only 30 minutes of study time. Let them take a break. Let them go for a sports class. They will come home a little tired. Then maybe you can structure another half an hour of study time, then dinner time, and then sleep time. So you are also not stressed as to what to anticipate, and the child also gets used to this routine, and gradually it helps with the neurobiology also. It helps with the rewiring of the brain as well. And that good night's sleep itself helps in reducing the hyperactivity to some extent, not great extent, but definitely helps in the child's emotional regulation as well. And sleep definitely plays a very, very crucial role. Also, as I said, nutrition also needs to be looked into. avoid high sugary sugar itself gives a lot of energy. So very sweet foods or cola drinks to be avoided, iced tea to be avoided. Iced tea has got immense amount of sugar. I see that many schools in canteens, they provide iced tea. I would strongly encourage schools not to keep iced tea in school as it has very high levels of sugar. Instead, use, as I said, high protein diets, which can include paneer, tofu, dals, pulses, and complex carbohydrate, millets. You can just mix some. I know children don't like, but you can make some interesting recipes. Now I'm learning with my kids also. They have a millet day in school, and first response will be, "Mama, please, you're the only parent who gives us healthy food." But then I try and mix the millet in such a way that they don't come to know that there is millet mixed. And then I'll tell them. Even in pancake, instead of using flour, I use jawar atta, or I use nachni flour, ragi flour, and make pan. And they love it. Just put jaggery in it instead of sugar. Add honey to it instead of sugar, and it tastes as yummy as a pancake made out of flour. So mothers need to get a little innovative and creative, but you'll be satisfied at the end of the day. The overall nutrition will improve. Their and it will help in all aspects. So these are some of the techniques that parents can use at home. For teachers, similarly in school, it's a huge group in classroom. So for the teacher, it's a difficult task. So if the child is already diagnosed with ADHD, or the teacher suspects that the child has ADHD, the child in the front, one instruction at a time. When the teacher is teaching a particular subject, only that subject book on the table, all other books in the bag, a little distant away from this child. Also, the child can actually be given some responsibility if he's hyperactive. And if the need is to get up and move, then by making him the monitor of the class, or by assigning him some job to collect notebooks for checking, or if the teacher wants to distribute something or wants to give something to another teacher in the teacher's room, then this job definitely should be given to the child with ADHD, because it will help them channelize that energy, and the child will not be disruptive in class. So such small things can boost the child's confidence. Also, again, rewarding the child in class, praising the child in class, not labeling, not judging the child, not calling the child lazy, will definitely help boost the child's morale and confidence, and the child will feel included in the class and not feel any different. And actually, this is not just for the important to treat everyone equally with respect, and that just because you're neurodiverse does not mean there is anything wrong with you, or that that there is some behavioral issue that needs to be addressed through punishment. And that creates a very empathetic and compassionate environment in schools, which is very nourishing and nurturing for the child.
Yes, ma'am, I can totally relate to answer of yours, because I totally understand when schools embrace these practices, they not only support students with ADHD, but also they create a more inclusive atmosphere for all learners, for all students.
Yes.
So by working together with teachers, parents, and the total community, so yes, we can totally ensure that every child can thrive both in academically as well as socially also. So I can totally relate to your answer here. So moving ahead to the next question, ma'am. How do you respond to individuals who believe ADHD means children are being disobedient, that stems from bad parenting, or that all children are simply hyperactive and just need to try harder to focus? How do you respond to such individuals?
Right. So see, mental health has always had a stigma attached to it, and not just for ADHD. I hear this for people with depression, people with any other mental illness also. You will hear n number of explanations or descriptions of these individuals and judgments being passed. But that's stemming not from deliberate or intentional acts, but it's more coming out from their ignorance or lack of knowledge. So usually I will hear them out, and then I will try and educate them and increase their awareness about the condition by explaining to them that this is a kind of condition that's resulting from exactly how I explained, differences in the way the brain is wired, and therefore this child is having. And for a moment, let's assume what you're saying is correct. And I always ask this to the parent. Whatever you're doing right now, if it is helping the child, continue doing it. But if it's not helping, then are you open to try alternative ways? Let's try and see if some other things might work. If it's working, great. Is what we are hoping that the child should study. Yeah, the teacher is, why is the teacher labeling the child? Because the child is not studying, child is being disruptive. But then the child, what the teacher is doing is punishing, or teacher is scolding, or teacher is making the child stand outside the class. I will ask the teacher, is whatever you're doing, is it helping the child? Or is it helping the child improve in his academics? Or is it bringing in any discipline into the child? Invariably, the answer will be no, because none of these punitive actions will help the child's condition, because there is a problem in the brain wiring, right? So sometimes it's by doing people understand more rather than just by lecturing, right? So I avoid lecturing. I said, okay, I asked them if whatever they're doing, it's not working, let's just try alternate ways. Let's try doing this. And let's do it as an experiment for a month and see whether it works. No harm in doing it. There is no, you're not giving any pill at the moment. So that way we try to psychoeducate and bring in awareness. And that therefore the acceptance is also more. Because if you try to, sometimes, people become then resistant to, if the doctor is very pushy and very authoritative and is not willing to take what the other person has, perspective the person has, then it becomes a battleground and there is less of acceptance. So it has to be a very collaborative approach, listening to what the parent, because see, ultimately parent is also going through their own struggles. It's not easy. It's not an easy journey, neither for the teacher nor for the parent. So it's important to acknowledge their emotions. It's important to acknowledge and hear their concerns out, and then come up with a plan which is mutually workable, doable, practical, and implementable in classrooms as well as at home. So no point giving some high funda knowledge to parents or teachers that will only stay with them for a day. It cannot be a consistent mode of action. So that's usually the way I approach any parent. And I can give you an example also. So we had this very interesting case of a 8-year-old boy who was referred to a school counselor. And then the child engaged in a severe behavioral disturbance in class, where he accidentally locked other children into the class. He ran out of the class. And so the teacher raised concern, and his parents were called, the principal was informed, and almost a disciplinary action was about to be taken, that this child cannot continue in this school because there was a risk involved to other kids. So then, fortunately, this child was being referred to our school counselor, and the school counselor had suspected that this is ADHD. Then they reached out to me. We had a meet. I called the parents. We assessed the child. Clearly, the child had severe ADHD. The child did require medication, and fortunately, the parents were very, very understanding and supportive of the child, and the child was brilliant. Like, the child's command over Marathi language was so good that it just astonished me. Like, an 8-year-old using such difficult Marathi words was very, very surprising to see. And we then started the child on medication. We suggested the same interventions, and we told the school that okay, let's do one thing. Let's come up with a plan. We understand your concerns. Yes, this is a serious concern. we'll do one thing. In the first 1 week, let the parent be waiting outside the school. If at all there is any behavioral concern, we'll immediately tell the parents to take the child home. And we instructed the same way that the child needs to sit on first bench. Maybe the child can attend the school only for first couple of periods, and half day the child can go home. So we started with small steps, baby steps. And today, Harshada, after about a year's intervention, the child is doing very well. The child is integrated academically, is not being expelled from school at all. The teachers are very happy. His parents are extremely happy, and so overall it has helped the child blossom. I think, in fact, it's from Harshada, you have been involved in this case, as well as Sangeeta Rishi Pathak, who heads the Child Learning Development Center. And both of you have done brilliant work with the child. So it's a team involvement. It's not just you, me, the mental health professionals, but the teachers' involvement, the parents' involvement, the authorities' involvement. All that collaborative effort has resulted in this student who was at one point almost being expelled from school to now continue studies in a regular school, doing reasonably well, and in fact has certain potentials which you and I don't have, which is great to observe.
Yes, thank you, ma'am. So, yes, ma'am, I believe that psychoeducating parents and teachers is a most crucial part from our side. I mean, school counselor, they have to psychoeducate teachers and parents time to time. And yes, you also said the same. So, ma'am, what are other resources or support system would you recommend for parents who have a child struggling with ADHD?
Yes. So, as I said, while I'm saying all of this, for a parent to deal with this every single day, to manage a child with ADHD every single day at home, can be very challenging. And therefore, the role of support groups becomes very important. So, support groups are usually groups of individuals who share the same concerns or same issues. So, there are ADHD support groups as well. And there is an Institute of Psychological Health in Pune which runs this kind of support group for parents with ADHD, parents of children with ADHD, as well as even there is a Vidula Psychological Consultancy in Pune which also offers this kind of support group. Moreover, school counselors, as I said, can be a great resource for as the first step in intervention. And Symbiosis also offers this Child Learning Development Center where all comprehensive services are being offered under one roof. So, as I said, often the child may also have some fine motor skill issues. One thing I did not mention is that often children with ADHD may have other neurodevelopmental issues also. So a child with ADHD may also have learning difficulty, or the child with ADHD may also have some fine motor skill deficits, or the child with ADHD can also have some behavioral emotional health issues like anxiety or conduct disorder or oppositional defiance. So there can be certain comorbidities. That is, along with ADHD, they might have some other condition also that might need intervention from different professionals, like an occupational therapist or a speech therapist or a remedial educator. Fortunately, at Symbiosis, we do have this Child Learning Development Center at our model colony pre-primary school, which is called a Symbi Star School. And we offer occupational therapy, speech therapy, remedial education. There's a play therapy set up in this center. And so the parent doesn't really have to take the child anywhere else. Under one roof, all the treatment will be provided. Along with that, of course, there are developmental pediatricians who are great resources. There are certain books that are written on ADHD, and people search on Google, you'll find n number of resources. There are certain, yeah.
Yes. Okay. So, thank you for sharing those insightful resources with all of us. Ma'am, before we conclude, what final message would you like to share with our viewers? How can they help spread awareness about ADHD and support children's mental health?
So important message is that be open-minded, be curious, and it's important to raise awareness about all neurodevelopment, all types of diversity, because not just neurodiversity, we should understand that every individual is different, every individual has strengths and weaknesses, and that if you don't know something, it's important to ask rather than just assume. Do not assume anything, be curious. As I said, early diagnosis and intervention can make a huge difference to children with ADHD. Therefore, parents need to be more attending such sessions, such awareness sessions conducted by schools or by professionals should definitely be attended by parents and teachers. And such collective raised awareness is going to help our kids with early interventions, which will help them travel a trajectory which will which will help them to reach their potential, right? So that's my message, really, right? Be aware and spread awareness around.
Thank you for those encouraging final thoughts, ma'am. Each of us has a role to play in spreading awareness about ADHD and supporting children's mental health. So thank you all for joining us today to discuss ADHD and its impact on individuals and families. We hope this webinar has provided valuable insights and fostered a greater understanding of the condition. Remember, raising awareness is crucial in breaking down stigma and ensuring that those affected receive the support they need. Together, we can definitely advocate for better resources, promote understanding, and empower our communities to support children's mental health. Let us continue to spread the word about ADHD and work toward a more inclusive and supportive environment for everyone. Thank you once again for joining and participating in today's webinar. So I would like to go ahead and propose my vote of thanks. As we come towards the end of today's webinar, I would like to extend a heartfelt gratitude to everyone who joined us for today's webinar. A special thank you to Dr. Girija Mahale ma'am for her valuable insights and expertise. Your passion for children's mental health is truly inspiring. We are grateful to have you. You shared a very insightful resources to us. So thank you, ma'am, for your valuable time as well as wisdom. I would also like to thank our IT team, as without their support, this webinar would not have been possible. So thank you.
Absolutely. Thank you, Harshada, and thank you to all our viewers. Thank you to Symbiosis and our wonderful IT team for supporting all our webinars and awareness activities. Thank you and good day.
Good day, ma'am.
No questions, right?
No, ma'am.
Have they stopped the live screening?
No, ma'am.
Can you ask Sangeeta to call him and stop it?
Okay.
Yeah.